Hello and welcome back to 90 Seconds Healthcare with Dr. Samer Ellahham, cardiologist, clinical professor. The topic today is really from heart to heart, and I really mean it. Raising awareness about high blood pressure. The number of issues, misconceptions, myths that I hear or I face in this field are almost unlimited. And I thought to summarize it for the public in a very simplified way. I will have this in two different languages. So I will start with the English today. I hope you're doing great. Again, I'm a cardiologist and I give you my 1 cent, if you like, on the topic. I think it's quite important. High blood pressure is also called hypertension. Hypertension is defined as systolic blood pressure of 140 millimeter of mercury or greater. Obviously, we want the blood pressure to be even lower, but this is kind of a basic definition. What is systolic? Systole is squeezing of the heart when it squeezes the blood. So 140 is squeezing. Diastolic blood pressure of 90 millimeter or greater or taking antihypertensive medication. So 90 is when I relax. So 140 over 90, 120 over 80 means squeezing versus relaxation of the heart. So high blood pressure is not very difficult to diagnose, but there are many, many errors and mistakes in understanding it and dealing with it. I don't want to scare you, but it is called the silent killer. Typically, there are no symptoms. Some patients tell me I had headache. A couple of them said they felt weak. Some of them said I was a little bit short of breath. But for the most part, typically hypertension is silent. It can affect the brain and causing stroke, but very importantly, dementia and major memory loss. The arteries can be markedly damaged, both in the heart, the brain, and the lower extremity. The heart, not only heart attack, but also very weak heart. And very importantly, maybe we don't see this with some of the other risk factors of cardiac disease or heart disease, such as dyslipidemia, the high cholesterol. We don't see as much kidney disease as we see with hypertension. So very, very important, the kidney disease. Not to scare you again, the word killer sounds scary, but we want to prevent and manage rather than scare and create a chaos or lack of comfort. And I'm still smiling. So high blood pressure, the world's leading killer, it is clearly the number one killer. And this is from many studies of WHO, World Health Organization, a gentleman called Gonzalez with many publications in major journal and many others. Number one thing to focus on is high blood pressure. Know your numbers. And the interesting thing is if we address it, then the impact is great. So message of be careful, but also a message of hope and let's do something about it. Let's go ahead. So the number one thing that we hear is how do I take my blood pressure? And I find this to be a major concern. People do not take their blood pressure appropriately. You can have it done at the hospital or the clinic. Even there, you may be in a rush. You may be wearing, clothes, and maybe that's not removed or easy to remove. But let's make the assumption that you're going to take your blood pressure at home, which I highly, highly recommend. And the guidelines, both in the United States, in Europe, and in our area, highly recommend that we take our blood pressure at home. So number one, we want to have seating where we are upright in the chair, not, bent or lying down. The cuff side need to be appropriately placed above the elbow. And typically we talk about 2 or 3 fingers. We need to make sure the size is appropriate. We shouldn't be talking or laughing. We should take at least 5 minutes of rest. Ideally, the bladder is empty. Ideally, we are in a steady state, we're stable. We also are looking at the blood pressure device appropriately. The arm should be less rested. The legs should be uncrossed and on the floor. They shouldn't be flying. And then we can take it. And this is very important. And please, please keep that in mind. Two types of high blood pressure, 95%, if not more, we don't know why the patient has blood pressure. It's a gene that got transmitted through family. It is whatever it is. But, in only 5% of the cases or so, it could be related to the glands, could be related to the kidneys, or few other things related to the aorta and other blood vessel. Again, mentioned it, but I want to reinforce it again and again. Hypertension, high blood pressure can affect vision, can affect kidneys, can affect pregnancy, can affect brain, can affect heart, can affect everything, can affect lower extremities, can affect the huge aorta, the largest blood vessel that we have in our body. So it's very unusual, but it is silent. It can be a killer. It is the number one thing to focus on, affects everything, but addressing it brings back hope, and we can prevent all these things if done appropriately. How can we address blood pressure? Just kind of some things. WHO talks about follow medical advice, take medications as prescribed, regular check blood pressure, and reduce and manage stress. Remember my A, B, C, D, E, F, S? The S is stress management for heart, for blood pressure, for everything. Another way to look at this is to say, hey, we're not just going to talk about medication. We're going to talk about lifestyle and medication. So maybe this is a little bit even more informative. So number one is check your blood pressure regularly. What does regularly mean? I mean, ideally once a day will be great. And, please do it with the method and the details that I mentioned previously. Number two is take your blood pressure medication as prescribed at the same time. And please do not skip any. If you have any issues or any side effects or any concerns, go back to your healthcare provider. Do not make the decisions on your own, please. Although we highly respect your engagement, we want you to be engaged, but please share your concerns with your healthcare provider. The third thing is eat a healthy diet. There are many diets. I mean, the simple thing to remember is salt, replace it with maybe lemon, as salty and sour can taste very similar. Second thing is the DASH diet. We call it the dietary approaches to stop hypertension, is an evidence-based diet that can lower blood pressure several millimeter. The third thing, which is very important, is a healthy overall diet, which is very balanced. That's kind of a general rule. Four is have an acceptable body weight. Again, we don't want to be obsessed with body weight. We just want to be healthy, not thin. We want to be healthy. And typically we talk about 5% weight loss from the current body weight if it's elevated. And we usually relate the body weight, the height, with the weight, which we call it body mass index. Great. Please, let's keep on. Number five, 30-minute walk. So today I happen to be off. I did my walk and my exercise, so I'm practicing what I'm telling you to do. And we usually say 30 minutes is quite good. You want to use the watch, fine. You want to do whatever you want, fine. You want to do more, fine. But sustainability is a lot more important than the, big wig stuff. So, if you could do something in a sustainable way, it's much better than doing it once in a blue moon. Six is smoking. So there is nothing more harmful that is socially acceptable than smoking. So we respect all smokers. We know, these are very important individuals in our society, and we have nothing but all the respect we can give. But the respect comes also with care, and we really need to make every effort to quit smoking. Smoking affects not only like blood pressure, all the things that I mentioned. It takes you into the lungs and takes you into the cancer, the tumors, the erectile dysfunction, etc., etc. So smoking opens even a worse gadget and a major concern. And please remember, I realize that nicotine is 3 times more addicting than anything else, but still quitting smoking is key. Seven is avoid secondhand smoking, extremely common. Close places, it's called smoking area, very important to avoid, especially in some countries more than others. Eight, manage stress, easier said than done. The walk, the muscle relaxation, the deep breath, and the cognitive behavioral therapy, even before we go to any specialist, just take the thing and put it in perspective. Example, I'm your physician. I see you in a shopping mall. I don't say hello to you, so you feel bad about it. It's for your privacy that I'm doing this. See you next time in the clinic, and that doesn't have to be me. It can be any of your colleagues who doesn't say hello locally or globally. And I explain, or they explain, hey, Either I was busy or did not notice, or for your own privacy, I didn't say hello. So then the whole experience can be modified, and that can remarkably decrease and disseminate and minimize the stress. Nine is avoid alcohol altogether, or at least limit it as much as possible. And very importantly is the support. So make every effort to get support, even if you are not surrounded by many individuals. Just go walk, talk to people, and reach out. And this has been shown as 10 in lowering blood pressure. Again, high blood pressure is a modifiable risk factor for cardiovascular disease. And again, you don't need at all to know the medical stuff. This is going to be only one slide, but there are three messages from the slide. Like with high cholesterol or hyperlipidemia or dyslipidemia, same with high blood pressure or hypertension. We don't make decisions based on the mood or the day or what we think or what we like. We base decisions based on three things. Number one, knowing you, knowing the person, knowing the patient, knowing oneself. We don't treat a number, we treat the person. It's extremely important. It sounds like it's blah, 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 it's just talking, but it's actually very important to treat the individual, the person. Risk factors, other problems, diabetes, hypertension, plus other things. What is going on? So that's number one. Number two, we look at the guidelines, whether they are the European or the American or any other established, accepted evidence-based guidelines. And then number three, we discuss it with you to make sure that we do what we call medication reconciliation. What medications are you taking? Did you take this medication? Did it bother you? How did it bother you? And create a dialogue. So this is like my triangle, and I'm sure my other healthcare providers triangle. And then we can initiate therapy. And now if therapy is needed, we're leaning more towards combination therapy and once a day medication to improve the compliance. So this was my few cents, as they say, on the topic. I do hope this was helpful.